So patients will sometimes ask me, what's the difference between Botox and a filler? Well, the simple answer is, this is a filler, and this is Botox. But that's not the complete answer. You know, the issue is this. What Botox does is it works on the muscles that create creases. So it's the muscle that moves the skin that makes the creases. So whether these are lines in this area, the glabella, or these are lines at the side of the eyes, the crow's feet, that's all caused by the activity of the muscle underneath there causing the skin to create creases. So the best way to do something about those creases is to knock out the activity of the muscle. And we do that in a very straightforward fashion utilizing Botox. It lasts for about 3 months, sometimes a little bit longer. And that usually takes care of the problem. It's not instantaneous, but that is the best solution because we're knocking out that activity. So would I want to use filler in those areas? And the answer is no, not really, because what a filler does is, think of putty. We're using this material to fill in that space to improve the crease. So if you want to be fancy about it, Botox is something for dynamic lines. Filler is something for static lines, or those which are there anyway. So if we have hollowness in this area of the face, if we have it in the nasolabial folds, if we have some other areas, then we can utilize that to kind of fill in that space so that it becomes less noticeable. It's extremely effective. This stuff will last anywhere from about 9 months to about 18 months, depending on which filler we're using and how we're using it. So can they be used at the same time? Yeah, sure, we often do, because sometimes patients will have things that are best treated with Botox and other things that are best treated with fillers. The two shouldn't be confused, but these are tools that can be used in a complementary fashion to give you your best result.